My job is to heal wounds and to allow people to come back together to each other and to allow families to sit in discomfort and learn how to support each other and to know that they can come out the other side of a crisis and move from surviving to thriving. Hi, my name is Chloe, and I am the Family Program Manager here at Launch Centers. For me, family therapy is everything because no one wakes up one day and says, I want to blow up my life as badly as I can. There are things that have led to that situation, and oftentimes it's learned behavior. So what I try to do is let's go back to where this started so you as the parent can break the cycle and you as the kid don't have to just go, oh, I'm following what my parents did. In some treatment models, it can be a send my kid to treatment, fix my kid, and what ends up happening is the kid does really well in treatment, they come back to the same environment and they're right back where they started or even worse. So I like to look at it as a how can the family heal from this? So when you do leave our program, that you aren't in the same cycles that you were before. I always say nothing changes unless we change it. And that's kind of the approach that I take is the whole family system has to be willing to change. So something that I like to do in the first session, it seems really simple, is developing a family goal. The metaphor that I use is when you're on the other side of the rainbow with your kid, when they've come out the other side, what do you want that relationship to look like? The parallel process is going from having your kid be your identifier, and it's allowing yourself as a parent to become the star of your own life. That when parents find themselves in this situation, their children have become their entire life because they're in crisis. I do a little hand motion with the parents that I say, you usually come in like this. It's time that your lives go like this. You're living your life and your kid is living their life and you're going along the same rails, and maybe you can come in for some support, but it's really about you gotta walk the path on your own. You gotta do it yourself. I really try to make it mandatory that they come to the family group that I run. And it's an hour once a week where you are not talking about your child. You're talking about you. What are you going through this week? Even if your kid is 25 or your kid is 18 months, they are watching you. And they are watching what you are saying, and they're also watching what you're not saying. So if you notice that it's like, hey, my kid needs to go to treatment, but I can't get them out of bed. I'm gonna start going to meetings. I'm gonna start going to a therapist. If you are modeling that I'm just gonna live my life like everything's fine, then you're sending that message to your kid that I'm not seeing you, or that I'm pretending that everything's fine, and that's probably been a cycle that hasn't been helpful. Then you can start applying those skills to the relationship with your kid, and hopefully they'll kind of catch on, or then you can start setting boundaries. I really operate from the belief that love is boundaries, and the way that we communicate love is by saying what's okay and what's not okay. And then how do you communicate that? Oftentimes it's not the boundary that the parent's having a hard time with, it's communicating it and then holding it. They can set it the first time, but then once it gets pushed, they have no idea what to do. So the boundaries that we kind of work with are kind of twofold. So there's the kind of the more cut and dry boundaries, but the more emotional boundaries that I like to work with is how do you self-regulate in the moment? So I try to get parents and kids to set boundaries from a place of I've thought about it, I've stopped, this is what I need. And if you can't do that, then such and such will happen. Starting easy, and how can we ease into it with sometimes you not even realizing that you're setting boundaries because you're just saying what's okay and what's not okay. We are constantly on them about accessing themselves. So when we come into family therapy, it's what does the family need? How can we be more healing and be more cohesive?